Hi there! If you have been prescribed Renflexis for ulcerative colitis, then you may have some questions. Starting anything new can be challenging. The good news is, knowledge is power. This video will walk you through what you can expect during your intravenous IV infusion of Renflexis. Renflexis is a treatment used in adults, children, and teenagers with moderate to severe ulcerative colitis. Your doctor has chosen to treat your ulcerative colitis with Renflexis because your disease is still active, even though you have tried other treatments. Ulcerative colitis causes inflammation in the lining of the gastrointestinal tract. There is currently no cure for ulcerative colitis. Ulcerative colitis only affects portions of the large intestine, including the rectum and anus, and typically only causes inflammation on the inner lining of bowel tissue. It almost always starts at the rectum and extends upwards continuously through the colon. People with ulcerative colitis experience severe and bloody diarrhea, false urges to have a bowel movement, abdominal pain and cramping, nausea and vomiting, decreased appetite, weight loss, mild fever, anemia, and loss of body fluids. Ulcerative colitis is a lifelong disease. Here's how the treatment process works. A designated healthcare professional will administer Renflexis to you through a needle placed in a vein in your arm. This is called an intravenous infusion. For ulcerative colitis disease, you will receive an infusion at 2 weeks and 6 weeks after your initial treatment, followed by an infusion every 8 weeks. Your infusion location will be determined by your healthcare professional. The infusion can take place in a number of settings, including a specialty infusion clinic that is part of the Merck Harmony Infusion Network. You probably have questions about what to expect on infusion day. Let's help you prepare. Let's start with packing your clinic bag. Here are some things you can bring from home to help make your infusion as comfortable as possible. First up, entertainment. The entire process can take about 3 to 4 hours. The good news is, many clinics have Wi-Fi and comfortable chairs so you can relax with your tablet or phone during the infusion. Just remember to pack your headphones so you don't disturb other people in the clinic if you want to watch a movie or listen to some tunes. Next is comfort. While the clinic chairs are comfortable, you may want to bring an extra pillow or blanket to help keep you warm and cozy during your infusion. We want you to feel relaxed. Lastly, be sure to ask your clinic nurse or doctor any questions you have about the infusion or your treatment. Making a list of questions will help you make sure you don't forget anything. Don't be shy. They're always there to help. Once you're all packed, be sure to get a good night's sleep before your appointment. Here's a few things you should remember on the day of your infusion. Make sure you eat a healthy breakfast or lunch and stay hydrated before your infusion. It's easier for the nurse to administer the infusion when you're properly hydrated. If you have a health condition that prevents you from doing so, talk to your healthcare professional about how to safely hydrate before your infusion. Some infusion sites offer snacks and beverages. You are welcome to bring your own. Remember to also wear comfortable, loose-fitting clothing that you can remove easily if a nurse needs to check your blood pressure or heart rate. Layers are also helpful in case you get too warm or too cold. A nurse will greet you when you arrive for your infusion. Make sure to have your list of questions ready to discuss with them before you begin. Also, ensure to have a valid health card with you. The nurse will then check your vital signs, like your blood pressure and temperature, before setting up the intravenous IV in your arm or hand. They will then connect the medication to the IV line in order for the infusion to begin. You may also receive some pre-medications, if prescribed. Be sure to have your clinic bag ready with the items you pack to help you pass the time in comfort. Your infusion will take about 2 hours. But once you connect to Wi-Fi, you can watch a movie on your tablet, browse social media, or listen to some good tunes, whatever gets you relaxed. Just remember to wear your headphones so you don't disturb other people in the clinic. Before the end of your infusion appointment, check with your nurse for any post-infusion instructions, such as what to do if you experience side effects of the medication or have any questions. Once the infusion is over, you should stay for 1 to 2 hours to ensure you don't have any reactions to the medicine. You can pack your clinic bag and head home. But be sure to schedule your next infusion before you leave. If you are receiving pre-medications that cause drowsiness, we recommend you have someone drive you to or from your appointment. If you have any questions about Renflexis or where to go for your infusion, contact your doctor or call Merck Harmony at 1-866-556-5663.